A survey done by Feed Nova Scotia showed 80% of food bank clients identified a lack of income and cost of living as the major reason behind their food insecurity, and I'll table that. It's not surprising, Mr. Speaker. No money, no food. Yet, this government has not made support to help Nova Scotians put food on the table a serious priority. I'd like to ask the Minister of Community Services, does this government recognize that by failing to prioritize the cost of living crisis, more and more Nova Scotians do not have enough to eat? Thank you.
The Honourable Minister of Community Services.
Thank you very much, Mr. Speaker. And we know that vulnerable Nova Scotians, they need a variety of supports. And for those that are food insecure, I believe that all of our food banks across this province do an exceptional job. And I believe that that us working with our food banks locally as MLAs and becoming very aware of their needs, that you're more than welcome to come to me. I know some of you have, and I am grateful for that because we can then make those investments in those areas. Even schools, we're open to making investments wherever the community wants to help to ensure that people are eating healthy and well.
The Honourable Member for Hammonds Plains, Lucasville.
Mr. Speaker, folks on income assistance are struggling perhaps more than ever. 46 respondents of a Feed Nova Scotia survey for those that use food banks are on income support. 91% of them said that the amount that they're receiving monthly is inadequate to feed themselves and their families. I'll table that. The cost of inflation is further suppressing their ability to meet their basic needs. So I'd like to ask the Minister of Community Services, why did this government choose not to increase income assistance last budget?
The Honourable Minister of Community Services.
Thank you very much, Mr. Speaker. And again, vulnerable Nova Scotians need a broad range of supports. We know that. And that is why this government has taken a very thoughtful approach to it. My colleagues didn't leave this all up to the Department of Community Services. We sit together collectively talking about what needs are needed by Nova Scotians, and that's why we've increased and created the Seniors Care Grant. That's why we reduced child care. That's why we're talking about having possibly a lunch program in the schools. That's why we have increased wages for ECEs and CCAs, rent supplements. So we've covered a broad range.
The Honourable Member for Hammonds Plains, Lucasville.
I can appreciate, Mr. Speaker, to the Minister that there are many initiatives that are ongoing, but there seems to be kind of a piecemeal nature to the funding that's being distributed, and that creates a challenge. And we as a Liberal caucus believe that there needs to be a baseline that is set that gives people a stronger ability to meet their basic needs. New Brunswick, for example, has stepped up to increase income assistance to inflation. So, Mr. Speaker, I'll ask the Minister, will she step up and index income assistance to inflation?
The Honourable Minister of Finance.
Mr. Speaker, you know, I think about this carbon tax that's coming. And what amazes me, Mr. Speaker, is that the Liberals don't realize the drag that it's going to place on the economy. Even if people were handed money back, Mr. Speaker, there's still going to be a drag on the economy that they're not even accounting for, Mr. Speaker. And think about how that is going to hurt people across this province, Mr. Speaker. We don't understand, Mr. Speaker, how parties opposite can support that tax.
The Honourable Member for Fairview Clayton Park.
Mr. Speaker, Feed Nova Scotia notes that food insecurity can be devastating. People who are food insecure are more likely to experience poorer mental and physical health outcomes, which I can table. This government was elected on a promise to fix our healthcare system. Access to healthy food is critical to a person's well-being and a key social determinant of health. My question to the Minister of Community Services, if this government is so committed to the health of Nova Scotians, why hasn't this government made specifically food security a priority?
The Honourable Minister of Community Services.
Mr. Speaker, this government absolutely has been discussing and has made food security a priority. That's why I have ongoing conversations with the Minister of Education, with the Minister of Health, with the Minister of Agriculture. We are working as hard as we can to look at everything and come up with solutions. That's why we are discussing a lunch program. That is why during Hurricane Fiona, we increased income assistance for $150 to help with food loss, but we've also invested over $40 million during Hurricane Fiona. That's why the Department of Community Services continues putting millions of dollars towards Feed Nova Scotia. So we continue making those necessary investments. We know it's tough, but we are committed.
Fairview, Creighton Park.
Thank you, Mr. Speaker, and I thank the Minister for her answer, and I'm hopeful that the conversations turn into action sooner rather than later, because Feed Nova Scotia, who she's mentioned that they have funded, states in the table that I just documented, household food security exists when all people at all times have physical and economic access to sufficient, safe, and nutritious food to meet their dietary needs for an active and healthy life. The cost of living crisis is putting food security out of reach of many Nova Scotians. Mr. Speaker, 1 in 6 households in Nova Scotia are food insecure currently, 1 in 6. And with the way things are going, this is only expected to increase. Mr. Speaker, will this government make food security a priority, not just a conversation with other departments, and provide support to Nova Scotians who are just trying to eat? Thank you.
The Honourable Minister of Finance.
Mr. Speaker, when we think about food, we have to think about fuel, because the two often travel together. And when it comes to the production of food, the transport of food, the price of fuel, Mr. Speaker, is a big cost contributor to the price of food. So, Mr. Speaker, why is the federal government choosing to put forward a federal carbon tax, a liberal carbon tax at this time? Mr. Speaker, why? We don't understand it, Mr. Speaker, and that's why we've stood up to fight against it, because we know it's going to make the price of food more expensive. It's as simple as that, Mr. Speaker. If you've got a tractor in the field or you've got a truck on the highway, if it has to do with food, Mr. Speaker, you're adding a carbon tax, you're making things more expensive.
Mr. Speaker, last week the Premier scoffed at the leader of the NDP when she said that it's time to put food banks out of business. But this is the position of food banks themselves. Feed Nova Scotia recently said food is not the solution to food insecurity. Food support is critical to meeting the immediate need for food, but only bold policy intervention will create lasting change, end quote. Mr. Speaker, bold policy interventions include raising the minimum wage to a living wage, indexing ESI rates to inflation, and implementing a permanent system of rent control. Why does the government refuse to do these things?
I'd ask the member to table those quotes that she just... Okay. The Honourable Minister of Community Services.
Thank you, Mr. Speaker, and I promise I will not be as theatrical as the opposition member. But what I will be...
Order, please. Order, please. The Minister of Community Services has the floor.
Let me just remind people that Nova Scotians we're having a hard time, absolutely. And what this government has done, though, has worked across all departments. So let me begin. We introduced legislation to cap power rates, taking a strong stand against the Liberal carbon tax that is supported by the NDP, reducing childcare costs, increasing the child tax benefit.
Order, please.
And I think that the source of this particular proposal is relevant to this discussion. The source of this proposal is not the New Democratic Party. The source of this proposal is Feed Nova Scotia. And the proposal comes from Feed Nova Scotia in two important documents that I'd like to table. These are documents which were put forward by Feed Nova Scotia a little earlier this year. They're called the Feed Nova Scotia Policy Advocacy Survey Report and the 2022 report to our community of Feed Nova Scotia. And I'd like to say a few things about these documents, where this proposal for a premium waiver comes from. The Advocacy Survey document reports that 56% of food bank users in Nova Scotia say they have to sacrifice spending on food in order to pay for prescription medications. 50% of the people who responded to the survey said they didn't fill or collect a prescription for their medicine because of the prescription's cost, and that they had done that within the last 12 months. Wow. The second report, the Our Community report from Feed Nova Scotia, proposes that, this is a direct quotation, the government waive or reduce the deductible after the copay on some pharmacare programs. Then the policy advocacy report goes on to say, and I'm quoting again, with more than half the respondents sacrificing the purchase of food to pay for prescription medicine, even a $100 to $200 waiver on reducing the annual deductible could substantially reduce the out-of-pocket expenditure of about half of the food insecure clients in need of prescription drugs, unquote. So this is a singular and important policy initiative that Feed Nova Scotia has brought forward. And I must say, too, Mr. Speaker, if I could be permitted a second short parenthesis, that I don't think that the government's discourse and comments on food banks yesterday and today has provided a great deal of evidence that they understand what is contained in either of these two reports. A core finding of the 2022 Feed Nova Scotia Policy Advisory Survey Report is that government policy itself on income support and affordable housing is in fact a main contributor to the escalating need for food charity in our province. So just under half of food bank users report having that they derive their income from income assistance, and the overwhelming majority of that group say that their reliance on a food bank is directly related to the inadequacy of their income. And yet, the provincial government, this year has frozen payments on income assistance. And similarly, after lack of income, food bank users identify the high cost of housing as a chief factor preventing them from being able to actually buy their food. Nearly half of food bank users in the province report spending more than half of their income on their housing. And yet the government's current housing initiatives contain no place for expanding social public housing. So, and Mr. Speaker, of second parentheses, often when the need for government initiatives to mitigate the cost of living is raised here in debate, often the government responds that inflation is not a Nova Scotia problem, that it's a national problem and it's an international problem, and therefore beyond the scope of the government of Nova Scotia. And of course, this is partly true, but it is also largely false, because something's being intimated when that's said, which is not the case. And something that's being intimated that's not the case is that there's actually nothing that the government of Nova Scotia can do, which is not true. There are important things that the provincial government could do, and waiving seniors' pharmacare premiums for a year is one of them. Of course, we recognize, everybody recognizes, governments can't do everything, but they can make an important start. The start that this bill proposes is one that could provide meaningful and practical help to thousands of seniors in Nova Scotia during this time of intense cost of living pressure. Thank you, Mr. Speaker.
I recognize the Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. So it's my pleasure to stand up and talk a bit about pharmaceutical services and the bill that's put in front of the House today. So just to go back and talk a little bit about my honourable colleagues and some of the things they mentioned, I would like to give an overview, not to explain pharmaceuticals, but to answer some of the questions that were presented in the House. So the budget for prescription drug coverage in 2021-2022 was over $300 million in our province for benefits under pharmacare, and the province funded actually another $70 million for drugs provided through Nova Scotia Health, such as IV cancer therapies. So the magnitude of that ledger line in terms of what we pay in this province is pretty significant. And we know that that comes from a variety of different reasons, Mr. Speaker. Our population is quite senior. We know that our population lives with a lot of comorbid conditions as well. So those things contribute to the amount of pharmacare that is required across our province. So new benefits are added to pharmacare coverage on a monthly basis, and they're informed by a very rigorous program. So we make sure that what is being added meets the requirements of CADTH, which is the Canadian Drug and Health Technology Agency. And then also that there is a competitive pricing that's negotiated with the Pan-Canadian Pharmaceutical Alliance, or PCPA. So these two organizations allow us to ensure that we are adding medications and technology that is really thought out, well evidenced, and important. And I would mention as an example a drug that both the opposition and our government is very proud to have worked kind of in concert together, was the addition of Trikafta in the early part of our mandate, Mr. Speaker, which is really a life-saving and life-changing medication for people living with cystic fibrosis. So these two organizations, with our pharmaceutical services and extended health benefits team, they're looking all of the time to understand what are the new and relevant treatments that are going to have a meaningful impact to Nova Scotians in terms of the treatment. And so Trikafta would be one that we were very proud to be able to introduce and bring that to the formulary and cover in the province. So there is increasing public patient demand, I would say, as well. So to the member opposite's point, at some point this balloon, if we aren't very, very intentional about how we continue to look at a variety of different things in healthcare, that balloon is going to expand and it is going to burst.
Thank you very much, Mr. Speaker. Mr. Speaker, this cost of living crisis is impacting low-income families in Nova Scotia, but it's also impacting working families as well, Mr. Speaker. And yet this government has not indexed income assistance to inflation, nor changed the income criteria for any of its critical supports like home assistance grants as well, Mr. Speaker. This situation, this cost of living crisis, is not only going to affect individuals, it's going to impact our economy and potentially tax revenue to the province, Mr. Speaker. Considering that, I want to ask the Premier, will he consider indexing income assistance to inflation and changing the income criteria so that more Nova Scotians can access critical supports during this very difficult time?
The Honourable Premier.
Thank you, Mr. Speaker, and the member raises an important topic, and that is the cost of living crisis that's striking Nova Scotia, but really the entire country and North America in so many ways. So we know that families are under pressure. We see that every day. We hear that every day as well. As a government, we'll continue to look for ways to support Nova Scotians. We're continuing to look at possibly indexing some of the programs. HARP is one we're looking at. There's a number of other initiatives that we're looking at, but we'll look for ways to support Nova Scotians. We know that this cost of living crisis is devastating for many families.